Hey everyone, and welcome back to our channel. Today we're going to talk about a topic that is often misunderstood, but incredibly important: borderline personality disorder, or BPD. You might also hear it called emotionally unstable personality disorder, or EUPD. Let's clear up some of the confusion and talk about what it's really like. So, what is BPD? At its core, BPD is a mental health condition that makes it very hard to regulate emotions. Imagine your emotions are like a volume dial. For most people, it goes from 1 to 10. But for someone with BPD, it feels like the dial is stuck on 0 or cranked all the way up to 100, with almost no in-between. This emotional intensity can be overwhelming and can affect every part of life. One of the most well-known features of BPD is a deep, persistent fear of abandonment. This isn't just a simple worry about being left alone. It's a profound terror that loved ones will leave, which can lead to frantic efforts to prevent it from happening, whether the threat is real or just perceived. This can look like sending a lot of texts, needing constant reassurance, or even pushing people away first to avoid the pain of being left. This fear often fuels another key aspect of BPD: unstable relationships. Relationships for someone with BPD can feel like a roller coaster. One moment they might see someone as perfect, their favorite person, and put them on a pedestal. This is often called idealization, but if that person does something that feels disappointing or hurtful, that perception can flip dramatically. Suddenly the person is seen as all bad, and this is known as devaluation. This black and white thinking, going from idealization to devaluation, makes it incredibly challenging to maintain stable, healthy connections. Another major challenge is an unstable sense of self. Many people with BPD struggle with the question, who am I? Their self-image, goals, and even their values can shift dramatically depending on who they are with or what situation they're in. It can feel like trying to build a house on constantly shifting sand. This can lead to frequent changes in jobs, friendships, interests, and even identity, creating a feeling of being empty or lost. Then there's impulsivity. The intense emotions often drive impulsive behaviors, especially in moments of distress. This isn't just about making a spontaneous purchase. It can involve things like spending sprees, reckless driving, substance use, or risky choices. It's often a way to cope with overwhelming emotional pain, seeking a quick release or a distraction, even if it has negative consequences later on. Intense and inappropriate anger is also common. This isn't just getting a little annoyed. It can be a powerful rage that feels impossible to control, often triggered by what might seem like a small event to others, like a perceived slight or criticism. Afterward, there's often a wave of shame and guilt, which just adds to the emotional turmoil. Many individuals with BPD also experience chronic feelings of emptiness. It's a deep, gnawing void that feels like something fundamental is missing inside. People might try to fill this emptiness with impulsive behaviors or intense relationships, but the feeling often remains, contributing to a sense of despair and loneliness. It's also important to touch on stress-related paranoid thoughts or severe dissociative symptoms. When under extreme stress, someone with BPD might become very suspicious of others' motives, feeling like people are out to get them. Dissociation is another coping mechanism, where they might feel disconnected from their own body or thoughts, as if they're watching a movie of their life instead of living it. These experiences can be really frightening. So, what causes BPD? Like many mental health conditions, there's no single answer. It's believed to be a combination of factors. Genetics play a role. If you have a close family member with BPD, you're more likely to develop it. Brain function is another piece of the puzzle. Studies show that the parts of the brain that regulate emotion and impulse control may function differently in people with BPD. However, environmental factors are hugely significant, especially childhood experiences. Many, though not all, people with BPD have a history of trauma, neglect, or invalidation during their formative years. Growing up in an environment where your feelings are constantly dismissed or punished can make it very difficult to learn how to understand and manage them healthily. Now for the most important part: BPD is treatable, and recovery is absolutely possible. This is a message of hope. The belief that BPD is a lifelong, untreatable sentence is outdated and wrong. Specialized therapies have been developed that are incredibly effective. The gold standard treatment is dialectical behavior therapy, or DBT. DBT was created specifically for BPD and teaches 4 key skills: mindfulness, to stay present in the moment; distress tolerance, to cope with painful emotions without making things worse; emotion regulation, to understand and manage emotions; and interpersonal effectiveness, to build and maintain healthier relationships. Other helpful therapies include schema therapy, which helps identify and change lifelong negative patterns, and mentalization-based treatment, MBT, which focuses on understanding one's own and others' mental states. Living with BPD is an immense challenge, and supporting someone with BPD requires patience, compassion, and strong boundaries. It's crucial to remember that the behaviors associated with BPD are driven by intense pain, not malice. If you recognize yourself or someone you love in this description, please know that help is available and things can get better. Reaching out to a mental health professional is a brave and powerful first step. You are not alone, and there is a path to a more stable and fulfilling life. Thank you so much for watching and for taking the time to learn about this important topic. If you found this video helpful, please give it a thumbs up and consider subscribing for more content on mental health and well-being. Share it with someone who might need to hear this. Take care, and we'll see you in the next video.